So, from my own personal experience, I don't think I've called my doctor in 2 or 3 years, right? Everything is done via an app on my phone, right? So, when I'm up at the middle of the night with my toddler having an issue, right, I'm on my phone there at 3 a.m. in the morning, creating an appointment with my physician for the next morning at 8 a.m. They email me later on with my test results. It pops up there. So, I mean, that really is, I think, the vision for health IT in general and federal health IT, right, is enabling millennials and all these people coming up, right, with access to information at their fingertips pretty much 24/7. So from a NetApp perspective, what we're really interested in is building the data infrastructure that's going to be necessary to enable that sort of always-on health IT, right? So we're investing in shared infrastructure that can scale out to petabytes and petabytes of data that can encompass modern, very fast virtual desktops for clinicians in those offices meeting with patients, for dedicated infrastructure that can scale out to the billions and billions. We literally have conversations now with people about hundreds of billions of objects, which starts to boggle the mind, but that's the modern scale we're going to be required to, especially with these sensors everywhere and with data points everywhere. We're heavily invested in Flash to accelerate as a technology, right, to accelerate access to health IT records. And finally, and I mentioned this before, but one of the things we're really excited about is how do we harness the public cloud and plug that into federal health IT and really enable that scale and enable that growth while still providing all the data management and privacy and security.
Well said.